crack it.
MR Guided Focused Ultrasound. One of the services that Women's Centre prides itself on is its MR Guided Focused Ultrasound Surgery. Magnetic Resonance Imaging (MRI) at the Women's Centre is an advanced diagnostic technology which provides 3D imaging of internal organs without radiation. MR Guided Focused Ultrasound Surgery is a non-invasive outpatient procedure which uses high doses of focused ultrasound waves to destroy uterine fibroids without affecting any of the other tissues around the fibroid. The procedure is conducted in a magnetic resonance imaging (MRI) scanner which helps the physician see inside the body to pinpoint, guide and continuously monitor the treatment. The MR guided treatment uses the MR images to identify where the fibroid is and what portion has been treated without the need for any incisions. It also provides real-time feedback about temperature changes of the treated fibroid to make sure that the fibrotic tissue has been ablated, destroyed. The non-invasive outpatient uterine fibroids treatment is an alternative to hysterectomy, myomectomy and uterine artery embolization. More than 8,000 women have already undergone this incision-less procedure.
I'm Dr. Ramya Jairam. I'm a consultant and surgeon at Women's Centre, Coimbatore. So the topic I'm going to talk to you about today is about something which troubles a lot of women. Almost 80% of women suffer from a condition called fibroids. Now the minute somebody says fibroids, they immediately think it's a big tumor in the uterus and that is something which is life-threatening. But the truth is, fibroids 99% of the time they're not cancerous. So what a fibroid is basically under the influence of hormones in your body, the cells in the uterus itself become bigger and they form a mast cell. And these fibroids, depending upon where they are in the uterus, can cause problems such as heavy bleeding or pain, or if somebody is planning to conceive, it can also inhibit fertility. So where do these fibroids come in the uterus? They come usually either in the mouth of the uterus, and these fibroids are called submucous fibroids, and these fibroids can cause heavy bleeding or irregular bleeding, or they will prevent an embryo from implanting and cause infertility. The next type of fibroids are intramural fibroids, or fibroids which are present in the body of the uterus, and depending upon the size of the fibroids and the number of these fibroids, they can also cause heavy pain or bleeding and also cause infertility, because they also can prevent an embryo from implanting and growing in the uterus. Now, the third type of fibroid is something which grows superficially in the uterus, that is from the surface of the uterus, and these are called subserous fibroids. And these fibroids usually don't have any symptoms when they're about 4 or 5 centimeters in size, but as they grow bigger and bigger, they can put pressure on the lady's back and they can cause a lot of back pain, and also if suppose they put pressure on the intestines, they can also cause problems related to that. Now, once we have diagnosed these fibroids, what we do is basically when a lady comes to us with an ultrasound showing that she has fibroids, we at Women's Centre go to the next level of diagnosis, which is an MRI. So what information an ultrasound cannot give, an MRI can very clearly give, which is essentially how many fibroids are there, where it is located in the uterus, and how big the fibroids are and how many fibroids are there. And also another very important information that the MRI gives is whether the fibroid is dead or alive. What that means is that some fibroids start losing their blood supply and then they slowly undergo a natural death, and they are called dead fibroids. All this information is not available when you do a simple ultrasound, and an ultrasound cannot pick up also fibroids which are larger than about 24 week size or 24 centimeters in size, because it comes into the abdomen and it is not possible to get an accurate measurement of the size of these fibroids. So once we have done an MRI and we diagnose what type of a fibroid is and all the information that I had just mentioned, that is when we counsel regarding what type of treatment is best suitable for the patient. At this point, I would like to add that we are very proud that we are one of the first fibroid centers in India where we cover all different types of treatment for fibroids. Our range of treatments are from medical management, surgical management using 3D laparoscopy, and the latest technology, which is a non-invasive high intensity focused ultrasound procedure, which we do under MRI guidance, that is called MR guided focused ultrasound surgery. Now, when we choose medical management, these fibroids are small, or they are not the type of fibroids which will cause any significant symptoms for the lady, or these fibroids are partly dead fibroids. That is when she is suitable for medical management, and then we take it in that direction, which is either by injections or tablets which are available. The next line of management which we provide is surgical management. Not all fibroids essentially need surgery. We decide whether a lady needs surgery or not depending upon what symptoms she has, and also whether it is inhibiting fertility, or if it is a fibroid which is large and she has a family history where she is concerned about the fibroid and she wants to get it removed. And that we do it by a procedure called laparoscopic myomectomy, where essentially by using the latest 3D technology for laparoscopy, we have very good vision during surgery. We're able to accurately find out where the fibroid is and remove the fibroid completely and suture the area from which we have removed the fibroid nicely, and the lady has very minimal bleeding during surgery, and she can go home in a day after the surgery is done. She does not require any bed rest. She can resume all her normal activities within a day or so. So that is, we use 3D laparoscopic surgery to do a laparoscopic myomectomy. Sometimes a lady may require an open surgery if the fibroid is very large, which is more than 24 weeks size. Then she is not a candidate for laparoscopic myomectomy. That is when we decide on open myomectomy. Now, the next latest technology that we have at Women's Center for treating fibroids is called the MR guided focused ultrasound surgery. Now, I earlier mentioned that we do an MRI to diagnose these fibroids. That is the same technology we use for also seeing whether a lady is a candidate for MR guided focused ultrasound surgery, because not all women can be treated by this technology. It also depends on the number of fibroids that are there, whether the fibroid is a dead fibroid or a live fibroid, because if it is a dead fibroid, then we do not suggest this technology. And also, depending upon the size of the fibroid, again, if it is more than 24 centimeters in size, we do not suggest MR guided focused ultrasound surgery. So what this technology is that we make the patient lie down on her abdomen, and under MRI guidance, continuous monitoring, we focus high intensity ultrasound waves on the fibroid which come from the table on which the lady lies down. Now, when these ultrasound waves get focused on the fibroid, they create a lot of heat, and then under that heat, the cells in the fibroid die. This technology basically, is one of the latest available out there, and we have done more than about 500 procedures so far at Women's Center, and we've treated different types of fibroids for this. The advantages of this over surgery is that it has no scars, it is bloodless, she can resume all her activities in the same day. We've had women who go back to work the next day itself after getting the procedure done. So what this technology does is that we make the lady lie down on her abdomen, we focus high intensity ultrasound waves on the fibroid, and under the influence of the high intensity ultrasound waves, the fibroid undergoes cell death. When this happens, slowly the dead tissue gets absorbed into the lady's body over a period of time, and over a period of time this fibroid reduces in size. So it is not something which removes the fibroid, but basically the fibroid which is existing will undergo cell death, and your body takes care of it by slowly absorbing it over a period of time. Technology will take care of the fibroid which is existing, but there is always a possibility of the lady developing new fibroids, because again fibroids develop under the influence of hormones, and sometimes women have a genetic tendency for it as well. So she will be prone to getting new fibroids. We have treated so many women with this technology, and a lot of them have conceived spontaneously, a lot of them have conceived following IVF, and they've gone on to have normal deliveries and with no risk to the mother or the baby. I have summarized all the different types of technologies that are available at Women's Center to treat different types of fibroids. I'd also like to mention that we do something called hysteroscopic myomectomy also for fibroids which are present in the mouth of the uterus. So we don't have to go in again for invasive laparoscopic surgery, whereas we can do hysteroscopic procedure where directly we put in a scope inside the mouth of the uterus and take care of the fibroid which is in the mouth of the uterus. So we've covered medical management, we've covered surgical management, and we've also covered non-invasive MR guided focused ultrasound surgery, and this makes it a comprehensive one-stop solution for all different types of fibroids under one roof. Thank you very much.